erase what we talked about on the board earlier? Okay. All right, so looking at the assignment, chapter 6 and 7, practical, in your Canvas for step by step, we're going to learn how to use the ICD-10 book, the ICD-10-CM book, which is used for diagnostic coding, okay? And who can tell me, what does ICD-10-CM stand for? It's right there on the front of your book. Oh, y'all don't see it? It's not, okay. All right. Say that again, dear. Okay. And International Classification of Diseases. What revision? 10th revision. And what does CM mean? Clinical modification. So it's really important that y'all remember that. It's real important that you remember that. CPT, who can tell me what we said CPT was earlier today? What does CPT mean? Current procedural terminology. Very good. Very, very good. Okay, so now we already justified by saying the procedure code tells what the physician did or what the provider did. The diagnosis code, what does the diagnosis code do? It tells what is wrong or the matter with the patient. What's wrong with the patient? We can have all kinds of speculations. We can see signs and symptoms. But once that doctor realizes some of the signs and symptoms, based on the review of systems, he's going to declare a diagnosis code. A diagnosis code tells what's wrong with you. You have bronchitis, you have a migraine headache, you're going through menopause, are you having dysmenorrhea, amenorrhea, do you have toe jam fever? I mean, something crazy, okay? All right. Now, in the ICD-10-CM, you're going to first start looking in volume 2. Then you're going to look in volume 1. Some of my veteran students, maybe y'all don't know. Do y'all at least remember what I said about volume 2 and volume 1? I'll help you out a little bit. Volume 2 is the alphabetic index. The alphabetic index. And in the alphabetic index, there are the list of diseases or conditions in alphabetic order. Alphabetic order. Okay? Now, this is the first place that you're going to look at when you start looking up different diseases, different conditions. Okay? According to their condition. Now, we'll talk about, when I say condition, I mean like if it's appendicitis, itis mean what? Inflammation. So the condition of appendicitis is that it is inflamed, or it has a what? It has inflammation. So we're going to look at the condition. We're going to look under inflammation. Once we look under inflammation, then we're going to look up appendicitis. Does that make sense? Okay. So that's what I mean by condition. Volume 2 is your tabular. Your tabular. And your tabular looks, it has an alphabet with numbers. And it may say through 99. This may be 00. This may be 99. Okay? Back before 2014, before they changed the ICD-10, it was once ICD-9. When it was once ICD-9, it was 3 numbers. This was a number, this was a number, this was a number. Okay? Through this number. Okay? That's how it was back then with ICD-9. Since 2014, 2015, maybe a little sooner, 2013, they have categorized these things, these diagnoses rather, according to alphabet, according to the locations of the body, where it's located. There's 21 chapters in the ICD-10 book. Okay? Who can remember what I said? Repeat after me. There's 21 chapters in the ICD-10 book. Very good. Thank you, Linda. Okay. Now, this is going to be the second place you're going to look for your code, okay? Why? Why is this the second place? Why? You're going here first. You got to find appendicitis. Appendicitis may have a code. I'm just going to make up something. J01.9. You need to go in volume 1. Once you find it in volume 2, under what? Inflammation, you're going to find appendicitis, right? The code is J01.9. I'm just saying out of example. I don't know for sure. Okay, now, we need to go in volume 1 to verify. To verify. Does everybody understand that? Why do we need to verify in volume 1? Does anybody have an idea? Why do we need to verify this when we find it in volume 2? We need to make sure it is J01.9 in volume 1. Why do we need to do that? You got the concept. Very good. Very good. Because you have to see, so how many digits? This is 1 digit, 2 digit, 3 digit, 4 digit. We need to see if it needs a what? 6. Is this a 5th? You said 5th, right? There you go. 5th digit or a 6th digit. Okay? We need to verify. We really need to. That's just like you meet somebody and they say, I'm the richest woman in the world. I can tell you that. You gonna believe me? No. Why won't you believe me if I say I'm the richest woman in the world? You gotta verify that you are the richest woman. How you gonna verify what I say? How you gonna check me? Depending on the numbers you have. So what you gonna do? Google my name? Mm-hmm. Oh, she gonna Google my name, y'all. She gonna find out if I'm legit. Okay, so that's how you verify. Check it for yourself. Sometimes folks will lie. Folks will add little stuff that ain't supposed to be said or did, and they believe in it. Don't believe the hype. Don't. Okay, that's an old song. Anyway, now if we go in volume 1 to verify, then let's suppose it's saying, okay, it has a list here. It says J01. You're going to find the categories here. Then it's going to say J01.91.2, 3, 4, 5. And it may have a lot of things to say. And all this is J01.9, but it's going to end in 2, 3, 4, or 5. Okay, does everybody understand that? And it's going to be a little specific. Each one of them going to have a bit more specificity of what that diagnosis is. And let me say this, it has to be as specific, as close, as similar to the diagnosis that the doctor has written or declared about the patient. You can't just grab something out the sky. You're not the physician. You're not the MD responsible or the nurse practitioner or whomever like that. You have to code. Now, your job, every one of y'all, your job is to verify according to what the doctor put in the SOAP notes, okay? So now let's write down SOAP notes. Let's write down SOAP notes. SOAP. This means subjective. This means objective. And you only see this, I didn't spell it out. You only see this in the physician's office. You won't see this type of thing in hospital coding. That's something totally different. This is assessment. And this is plan. Okay? Assessment is where medical billers and coders live. This is our home base. This is where we live all day, every day. All day, every day. Everybody groove with me. All day, every day. All day, every day. Come on. All day, every day. Okay. All right. So, in the assessment part, you have diagnosis code and you have the procedure code. Who declares the diagnosis code and the procedure code? Who declares that? Who said who gives the diagnosis code? Who gives the diagnosis of the patient? The physician. Who gives what procedures of the patient? The physician. He gonna tell you on somewhere on paper, I have spent, that's a whole nother conversation. I'm gonna get deeper about how to do the CPT codes and how to look them up with the certain key variables. Right now, we're just dealing with diagnosis codes, so I'm gonna stick with that. But this is where you live all day. Now, subjective is a conversation between the nurse and the patient. Everybody say that's subjective? You okay, mama? Conversation between the nurse and the patient. You know, as well as some of y'all may have experienced going to a physician office. When you go to a physician's office, who's rooming you? The MA, medical assistant, okay? The nurse, they're rooming you. And then they're gonna write down some things. What are they asking you? What are they in your Kool-Aid about? Huh? How do you feel? Okay. What brings you in today? Very good. Which is known as an onset. Keywords for that is known as CC. CC means chief complaint. Who can tell me chief complaint, CC? Okay, so chief complaint. Why are you here? I'm here because I don't feel blah, 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 and I need blah, blah, blah. Okay. Now, she's going to take your height, she's going to take your weight, and she's going to take your vital signs. What are vital signs? Your blood pressure, your temperature. And somebody said oxygen, they were close. Respiration, very good. Temperature, pulse, blood pressure, respiration. Very good, very good. Excuse me, 4 key elements. Now, this is the conversation between the patient and the nurse. This is now going to be the conversation between the patient and the physician. He's going to look at what you told the nurse. Okay, Miss Pam, so you said you don't feel well today. You say you got a headache. You say your ears hurt. Your chest hurt when you cough. Okay, so there's 11 systems of the body. okay? And out of the 11 systems, he's going to say, okay, you got a headache. Okay, so that's the nervous system. Okay, you got an earache. Okay, I got to check that. That's part of the indexia. Okay, and then you say your chest hurt every time you cough. Okay, that's the respiratory system. So how many review of systems he has to check out of 11? 3. Has to check 3 review of systems out of the 11. Those ROS, review of systems, is going to be listed right here in the conversation, okay? Now, when he gets through looking and palpating on you and open your mouth and all this good stuff, then he's going to come to a decision. I think I know what's your problem. Your problem is blah, blah, blah. Maybe you have a sinus infection. Maybe you have the flu. He's going to write on here, patient has the flu, okay? Now, and then he's going to say, okay, I've seen the patient, because most doctors, especially if they know their stuff and they've been in the field long enough, they already going to know just by looking at you within 5 minutes what's your problem. So they're going to judge you about 5 to 15 minutes. So this is going to be like a level, this is a level 2 treatment, 15 minutes, level 2 treatment, okay? They're going to send you to have some x-rays. So that's going to be requested. So you're going to go and have that done at the hospital. Okay. And so the plan, who can tell me what's going on with the plan? What's, okay. Okay. What's going to happen to the patient? That's spelling it right. Okay. Cough syrup, some hydrocodone for pain. Not spelling it right. Okay. And then he's going to return to office in 2 weeks. Okay, RTO means return to office. He's going to return to office in 2 weeks. Okay, and hopefully you should feel better. If you don't feel better, when you come back to me, then we're going to try something else. Okay, all right, super fantastic. Now, why is all of this pertinent to your billing life? Why is it pertinent? Why is it important? What? All this information, the SOAP notes, everything. Why is that important to you? Well, it could be in your medical record. So it can be in the patient's medical record. Documentation is everything. Remember what I said? Who gave the declaration of the diagnosis? Was it the nurse or was it the doctor? The doctor did. So you, being the coders, your job is to convert this word, flu, into a number, such as this. That's going to be your job, okay? If the scribe, and I'll tell you what, I think I talked about the scribe goes in with the physician, they holding the laptop, everything that the doctor is saying, they typing it in the computer for the physician because information could get in a lot more quicker, a lot more accurate. Sometimes some physicians don't want to deal with that. They just rather hire a scribe, and you do. I just want to care about the patient. You do. Okay? All right. And this is going to also be your job to translate a level 2 15-minute visit into a what? Number. Does that make sense? Not all doctors' offices function exactly the same. Some you're going to have to convert into a number. Some you're going to have to verify if the diagnosis was chosen correctly, because sometimes with the electronic medical records, they have diagnosis and procedure codes already pre-listed within the software. You have to make sure that it is correct according to what the doctor stated in the objective in his conversation. Okay, because sometimes they can go real fast and say stuff and you miss it. Now, you're going to nominate or translate rather the office visit, but you're not going to translate over the x-ray. Why? Because that's been referred out to where? To the hospital. It's not done in the doctor's office, okay? That's done at the hospital. So there's going to be a note in there saying x-ray requested a slip or something given to the patient to have it done at the hospital or x-ray facility. Okay? All right. Super fantastic. So now we understand this. This means this is the right there in that other stack, lady. For week 2?
There's like 3. I don't know.
Oh no. I don't want y'all to have that just yet. What did you did?
This is all that's here. Only here we have practical 2 chapter 14. And then it's 3.
Okay. It should be out there. Just give me a few minutes, sweetheart.
Okay.
Give me a few minutes. Okay. So this right here is first digit, second digit, third digit, fourth digit, fifth digit, sixth digit. Sometimes you might have a placeholder, and then you might have another number right here. Placeholder, and then 7 digit, whatever that may be. Okay, so let's look at the first one. Let's look at the first one. Can I erase this? Y'all want to take a picture of it? Can I erase it? Okay. Look through it carefully, sweetie, because you saw everything in there, right? Okay. Because Celia just used it today, so everything should be in there.
It's on the other side.
Oh, yeah.
I forgot you
Recycle.
Yeah.
I do. Yeah, I do recycle.
Okay, I found it. Never mind.
Okay, it's okay. Okay, now let's look at number 1 under chapter 6 and 7. It says stiffness to the wrist. Stiffness to the wrist. Oh, stiffness of the wrist. I'm sorry. Of the right wrist. Okay. All right, so stiffness of the right wrist. What is the condition in this statement? What's happening to this person's wrist? Stiffness. Okay, so let's look under the condition in volume 2. Remember, we have to go in volume 2. Volume 2 is the gray area of the book. The first part, yeah, there you go. Yeah, there you go. Look up the word stiffness and tell me what you find. $60? Okay. All right. So you want to write that one down. And we're going to verify it in the tablet list. Yeah. Okay, did y'all find stiffness? Okay, did y'all verify it? It doesn't make sense? Okay. Okay, so now let's go and verify it. I want you to turn to the chapter, go up, turn back the other way. Yeah. Keep going. Are you out the gray chapter? Keep going. It's beyond the gray chapter. Keep going. Keep going. There you go. Okay, now go back to the very first chapter, very first page of that. See, does it say A? Does it start with an A? There you go. What does that say on that page? Diseases and injuries. Okay, that's the tabular list of diseases and injuries. I want everybody to find that page, diseases and injuries. And it should be a purple color, purple tab, beyond the gray pages, beyond, yeah, there you go. There you go. Keep going. Beyond the gray pages. Beyond the gray pages. It should be purple. And yeah, there you go. And Taylor, did you find it? Okay, it says list of tabulars. Yeah, I want the first page. No. Of the purple. First page of the purple. Okay, let me see it. Okay, very, very good. Now, she said when you found it in volume 2, it was M what? Okay, M 25.63. Okay, so we need to verify. Okay, we need to verify that. So go to the chapter where it begins with M. Go to the chapter where it begins with M. Look on the tabs. You already there, Taylor? Okay. M25. Okay, so did y'all find M2563? Okay, does it have a red dot by it? Okay, now look at the very, very bottom of the page. Go to the very bottom. It has all those unique symbols. Okay, and it tells you what those symbols mean. Can somebody tell me what the red dot means? Use additional characters or additional numbers, okay? So now let's go back up to the M2563. Okay, now, do we see anything that says stiffness of the right wrist? Anything specific? 2563-1. What do the other ones say? Are there any more that's like 2 and 3? What does 2 mean? The last ending of 2 mean? Okay. Thank you, sweetie. Okay, so it's the left wrist. And what does the other one say? What is it? Unspecified. Unspecified. So in case your physician, he puts on there stiffness of the wrist, and he may not put on there right wrist. I didn't even spell right all the way out. I forgot the T. Then you're going to use the unspecified code. But if he specified and says which wrist, then you're going to use what code? Uh-huh. And so it has what at the end? The one at the end. So how many digits? 1, 2, 3, 4, 5, 6. 6-digit code. So you did correct. Whenever you're coding, you want to code to the best specificity. Usually it's said to the highest, but I think if we say highest, it's kind of confusing because you think of dollars. That's not what we want. We want you to code to the best specificity, meaning we want you to code as specific as what the doctor written or what he intentionally wrote, but you got to get him to make sure he wrote that. Does everybody understand that? Okay, very good. Now y'all getting used to using the book. Okay, let's look at number 20. Ligament disorder of the right foot pain. I'm sorry, right foot joint. Ligament disorder. What happened to the ligament of the right foot joint? What happened? Look at the sentence structure. What happened? What happened with the ligament of the right foot joint? What happened to it? It's in disorder. So what's the condition? Okay, so the condition is what? You just said it. Disorder. So you're going to go back to the gray section. Oh, okay, you telling me.
Yeah.
Oh, I'm sorry, baby. I'm sorry. Okay, repeat what you said, Yesenia.
At first I took a bad ligament and I kind of was in the condition and it's disorder.
Okay.
And then from disorder I to the ligament of the foot and then I
Okay. Very good. Very, very good. Did y'all hear what she said? Now, and I'm gonna piggyback on what she just said. Yesenia just said she looked at ligament. Ligament told her to go look at the condition, which is disorder. Did it tell you that? Because it's gonna always give you breadcrumbs. The reason why I'm saying this is if you look in one spot, it's gonna tell you, no, not here. Let me give you some breadcrumbs on where to look. Look at the condition. The condition is what? Disorder. So you're not doing it wrong because how can I say? The book was written and designed in such a way where you just supposedly just can't get it wrong. It's gonna help you whether you bounce over here, bounce over there, it's gonna help you bounce to the right place. Okay, does everybody understand that? Okay, very good example, Yesenia. Very good. So it led her to disorder. Disorder. Okay. Now, once she went to disorder, it gave her so pay attention to this. When you are under the heading of disorder, it's going to give you some code or some words in brackets. This means the same or similar. All right. Now over here, you're gonna always want to measure up. It's gonna come one place over. This may say disorder of foot. Okay, and then it's gonna come another place over. This is gonna say disorder of toe, disorder of joint, whatever like that. Okay, now it may also say brain. I'm just being funny. Disorder of the brain, disorder of the brain, frontal, labial, frontal, posterior. Pay attention to how it slants, okay? If it slants like that, it's gonna always let you know. Okay, so this is the main term. This is the sub subterm. This is the sub term. Okay, this is the term. Okay, so always pay attention how it angles itself underneath one another. Did y'all notice that? Okay, very good. Okay, so you looked at disorder. So you looked at disorder and then it led you to ligament, right? Ligament. And then ligament, it should have given you something specific, right? Because you can't use not otherwise specified or unspecified. You have to, it is the doctor specified their right foot joint. Okay? Okay, very good. Very good. Okay, so now what kind of code did you get for number 20 in volume 2? Remember, we're still in volume 2. Okay, so we have M24.2. Okay, so we need to verify. Where are we going to verify?
Wait, where do we, I'm sorry. M24.27.
Okay, M24.27. What's your question, Yesenia?
I thought you were on.
Oh, no, I'm still on 20. Okay, so did y'all verify number 20? Did y'all verify the code M2427? Did y'all verify that? Okay, what is the actual code? Very good. M24.274. Very, very good. Okay, moving on to number 21. Patient suffers a non-traumatic hematoma of the soft tissue. Patient suffers a non-traumatic, that's an adjective that describes the hematoma, okay? Hematoma of the soft tissue. Okay, so the condition is hematoma. How many of y'all looked at hematoma? Okay, did you find anything under hematoma? No. Okay, so what's the next? What breadcrumb did it give you to look at? Disease. Okay.
I mean,
Contusion.
it does say under it does say stroke soft tissue.
Okay. Under the word hematoma. And then underneath it, it gives the sub-term soft tissue.
No, I'm sorry. It says hematoma and it goes non-traumatic.
Okay.
And it gives soft tissue.
So it gave the main term is hematoma. The sub-term is soft tissue, right? Non-traumatic. The sub-term is soft tissue. Okay, very good. Very good. And what code did it give you? Okay. Now we need to verify it. We can't believe he say he rich. We got to verify it. We got to go on Google. We got to know that he's telling the truth. It does say it right there? Okay, very good. Does it need an extra digit? No? Okay, Yesenia verified it. Taylor, did you verify it, baby? Okay, what about you, Sweet Pea Brenda? Okay, super fantastic. Super fantastic. Now, what I would like for y'all to do is over the weekend, I want y'all to do the rest of the questions on here. I know it's already done, but I want you all to practice it yourself on your coding books at home. I want you all to practice it yourself, okay? Because this is the real world. When y'all go out there in the real world, you need to know how to utilize these books. Technology is a beautiful thing, but it's not everything. All right. All right. Well, thank y'all so much. On Monday next week, we'll go over chapter 6 reports, and we'll learn how to code from actual operative reports. Okay. So I want y'all to learn how to do that. All right. All right, thank y'all so much, and thank you, YouTube family, and thank you to all my beautiful subscribers. My niece told me about y'all. I don't pay attention. I just lecture and turn it off and go home. But thank you, thank you, thank you for subscribing and hopefully, prayerfully liking my channel or whatever comments or compliments you have to have.